The tidal wave of flu, this strain that is now placed on the NHS, which has surged by 70% in just 1 week. This alarming rise is part of a broader crisis, a quademic of flu, COVID-19, novavirus, and RSV, which is straining the healthcare system to its limits. And recent NHS data paints a grim picture. Last week, an average of 1,861 flu patients were hospitalised daily in the UK, with 66 requiring critical care. This is a dramatic increase from the previous week, where 1,099 patients were hospitalised, including 39 in critical care. Admissions are already 4 times higher than this time last year. To compound matters, 95% of hospital beds are currently occupied, far exceeding the safety threshold, and ambulance delays and long A&E waits are the norm. Shockingly, 1 in 10 patients is now waiting more than 12 hours on a trolley in emergency departments. The past 2 winters saw flu claim 18,000 lives, but this season threatens to be even deadlier. The relaxation of pandemic precautions, a lack of robust vaccine uptake, and the confluence of multiple seasonal viruses have created a perfect storm. In my own case, in rugby, a complete laxity on the part of the local GP in promoting the vaccine, I think, is some sort of trigger that needs to be flagged up. If it happens here, it happens elsewhere. And we need to get out the message. We need to get the flu vaccine out earlier. We need to get the flu vaccine available, even if it's offered for a payment. And the rise in walking pneumonia, Mycoplasma pneumoniae, has yet another layer of complexity. While often mild, this infection is insidious, spreading among individuals with little notice until it develops into more severe pneumonia. NHS leaders like Sir Stephen Powis have urged immediate action. With 1 week left in the flu vaccine campaign, Powis and the Health Secretary Wes Streeting are calling for eligible Britons, roughly 30 million people, to get vaccinated, and nearly half have not done so. Streeting has also prioritised treating the sickest patients over hitting A&E waiting time targets, emphasising ambulance turnaround times to free up resources. Ministers have touted some progress. Waiting lists for elective procedures have dipped slightly from 7.57 million in September to 7.54 million in October, but this focus on routine operations, as Sir Keir Starmer has pledged, risks sidelining emergency care, a concern NHS bosses have flagged. The NHS enters this winter with vulnerabilities laid bare, staff shortages, underfunded services, and a system running red hot. Daniel Jeffreys from the King's Fund warns that the current occupancy levels are unsustainable, with little slack for unexpected surges. Moreover, the public's hesitancy to vaccinate is troubling. Flu vaccines, while not perfect, significantly reduce the risk of severe illness and death. And yet public messaging seems insufficiently persuasive, or indeed available. What should be a preventative triumph risks becoming a cautionary tale. A renewed urgent push to vaccinate must be the cornerstone of our strategy. This requires more PSAs. It requires targeted outreach, particularly for vulnerable groups. Emergency care must take precedence over elective targets. The NHS needs flexibility to redirect resources where they're most needed. Clear communication about the dangers of flu and respiratory viruses are vital. Messaging should highlight the collective responsibility of vaccination, not just protecting oneself, but easing the burden on the NHS. And the recurring nature of these crises demands a better prepared healthcare system. Investment in workforce expansion, hospital infrastructure, public health initiatives, they cannot wait until the next winter crisis. The tidal wave of flu is more than a health crisis. It's a reflection of the fragility of our system, and addressing it requires coordinated action from government, from healthcare leaders, from the public. And vaccinate, educate, prioritise, those are the key words that need to resonate across the nation. It's the prescription for weathering the storm.